So, a 2025 Edelman Trust Barometer special report on trust and health indicated that trust in healthcare institutions saw a significant drop from 2023 to 2024. The past few years have profoundly reshaped our world, and with it, the landscape of trust in vital industries, including healthcare and life sciences. While our collective health became an undeniable star of the show during the pandemic, the journey to sustained public trust is certainly a work in progress. And it's not just a blip, it's a clear signal that people are feeling very skeptical. We have to keep this in mind when we're looking at branding in the healthcare and life sciences world. This statistic underscores a clear message that transparency isn't just a buzzword, it's a bedrock of credible branding in this post-pandemic world. So patients, caregivers, and healthcare professionals are really demanding more, and rightly so. They want to understand the why behind decisions, the how behind scientific breakthroughs, and the what behind the cost. So how are we going to bridge this trust gap in healthcare and life sciences? I believe it begins with a radical transparency across every touch point of your brand. From groundbreaking research and development to the nuances of patient care and even the details of financial models. You have to show proof and you have to show transparency. When organizations openly share their processes, their methodology, and even your challenges, you're demonstrating integrity and a genuine commitment to the public well-being, which is what it's all about in this world of science. Not just the bottom line. It's about pulling back the curtain and not just letting people peek through a crack. So there's another survey that Emory University and Gallup did in early 2025. And in that survey, they found that trust in national public health agencies experienced declines. Trust in personal physicians, however, and local health departments has actually rebounded to pre-pandemic levels. This is telling us that proximity and personal connection still account for. People trust what they can see, touch, and understand, which we've always known. Ethical considerations, however, are not footnotes. They are going to be a core to your brand's narrative. So if you're in life science and healthcare and you're looking at branding, there are a few things to think about. First of all, really clear communication. Ditch all of your jargon. Explain any complex science or medical procedures in terms that anyone can understand. No more talking at people. Let's just make sure we're talking with them and creating a conversation and narrative. Secondly, having accessible information. Don't hide the data. Keep that data and patient resources easy to find and comprehend. Don't make people go on treasure hunts to find vital information. Third, patient stories. Make sure you have consent, but make sure to humanize the impact of your work through authentic experiences. Real people, real stories. That's what builds real trust. And then finally, fourth on the list, accountability. We all need to own our mistakes. In life science and healthcare, this is so important. People know that we're all human. And when you admit to a slip up and then you fix it, that goes a long way. It shows you're the grown up in the room. And it helps reinforce a brand that's all about taking care of people. In the world of life science and healthcare, information spreads instantly, and your brand's reputation is built on trust, one transparent interaction. So by prioritizing openness and ethical practices, your brand can not only rebuild confidence, but also forge a stronger, more meaningful relationship and connection with people that you serve. It's not just good business, it's the right thing to do, and it's how we ensure a healthier, more trusting future for